What are the available cleaning pills for post-abortion wound cleaning?
Hello, everyone. Today, we are going to discuss a sensitive, yet important topic, post-abortion care, specifically focusing on the role of so-called cleaning pills or medication that is used after an abortion. The safety and well-being of women is paramount, and that's why it's important to talk about this issue openly and honestly.
What is post-abortion care?
Post-abortion care involves a series of medical checkups and treatments to ensure the health and well-being of a woman after undergoing an abortion. This includes monitoring for complications, providing contraception options to prevent unintended pregnancies, and offering emotional support. It's important to clarify that the term cleaning pills is not a recognized medical term, but seems to refer to medications given after abortion.
What medication is usually given post-abortion?
After an abortion procedure, healthcare providers usually prescribe a few types of medication. Antibiotics are often given to prevent infection. It's crucial to take them as prescribed to ensure any potential harmful bacteria are eliminated from your body. Pain relief medication may also be provided to manage discomfort or pain. Hormonal contraception can be given for those who wish to avoid another pregnancy but are not ready for a long-term or permanent method of contraception. Remember, these medications are prescribed based on individual needs and conditions, and they're intended to ensure your safety and well-being, not to clean the womb.
Is there a need for womb cleaning?
The concept of womb cleaning post-abortion is a misconception. The body naturally expels the pregnancy tissue during an abortion, and the uterus will heal on its own. If any remnants are left behind, which is rare, your healthcare provider will address it through a procedure known as uterine aspiration or a D&C, dilation and curettage. It's crucial to understand that there's no need for additional medication or procedures to clean the womb after an abortion, unless there's a specific complication such as an infection or retained tissue, which should be managed by a healthcare provider. In conclusion, it's important to consult with a healthcare provider about your post-abortion care, rather than seeking cleaning pills or any unverified treatments. Each person's needs are unique, and a healthcare professional can provide guidance that's specific to your situation and health status. Remember, your safety and well-being should always come first. Take care of yourself, and don't hesitate to seek professional medical help when you need it.